Here's your IQ question for the week. Eyeglasses. How do you choose which type is best for you, whether you get tinted lenses, transitional lenses, or polarized lenses? Well, my guest today on the IQ podcast is going to help us make that decision. So stay tuned for this week's episode with me, your host, Dr. Rani Banik. Today, I am so excited to welcome to the IQ podcast my guest, Dr. Jennifer Tsai. Dr. Tsai, founder and owner of Line of Sight, is passionate about eye health and seeks to provide a concierge level of service to all of her clientele. She is a nationally recognized authority in the emerging fields of dry eye, digital eye strain, myopia management, and ocular aesthetics. Passionate about the intersection of beauty and eye care, she leads her team in delivering thoughtful, concierge based care, utilizing the cutting edge of preventative therapies and regenerative medicine. Dr. Tsai is often seen as an eye care expert in national television and media publications such as ABC, Vogue, and Good Morning America. And if you're on social media, you've probably seen Dr. Tsai's amazing content on eye care on both Instagram and TikTok. So it's my great pleasure to welcome to the IQ podcast, Dr. Jennifer Tsai. Welcome, Dr. Tsai. It's such a pleasure to have you here.
Hi, Rani. Thank you for having me. The last time I saw you was when we did Insider Science. That was really fun. We debunked
I can't believe that was about almost a year and a half ago, I think. It was in the middle of the pandemic. And so if anyone is interested, you should check out our episode. We talked about eye myths and we debunked a bunch of eye myths. So it's on YouTube. Please check it out. But yeah, that was a lot of fun. But it's so great to have you here. And I always like to start off the podcast by asking my guests, please share your background story. Like, how did you get interested in eye care and specifically optometry as a career?
Yeah. It's funny, anything that could go wrong with my eyes happened to me. So I remember first when I wanted to be in healthcare when I was in college, I didn't quite know exactly what field I wanted to go into. I knew that I wanted to be within healthcare in general. So when I shadowed and practiced in all these different specialties in the hospital setting, I remember like fainting when I saw blood. I was like, I don't think a hospital setting is necessarily ideal for me. So I started to research more of like, what could I do in private practice settings? And around that time is when, leading up to it, I stepped in my contacts, got a pretty bad corneal ulcer, almost lost my vision. So I had to see an optometrist. I also remember getting a routine eye exam and they detected bilateral retinal tears. And that can basically cause sudden vision loss. And all these things happen. And it made me realize two things, like how important vision really is, how we take it for granted. And it's something that, we wake up with, that we use, and the last thing we use before we go to bed. So I really wanted to spend more time on eye care. But the second reason is because all the ophthalmologists and optometrists that I shadowed and who actually saw me when I was a patient really took good care of me. They were very compassionate, very caring. And I got to see a little bit of how they practice. I think it is a perfect blend of being able to see your patients come back year to year and build that connection with them, but also allows you to build a private practice. And it involves more like of a preventative approach for patients as well. So.
Yeah, absolutely. And actually, I find it interesting. A lot of people who do go into the eye care space have had personal eye issues. I've talked to so many people, or, perhaps it's a family member. They'll say, oh, my grandparent has glaucoma or macular degeneration, and I saw how it impacted their life, and I really want to make a difference. So I'm so glad you made that decision because you've helped so many people along the way as an optometrist. Now, I know a lot of people also they get a little bit confused because there are different types of eye care providers out there. There are optometrists, there are ophthalmologists, there are also opticians. So there are actually 3 O's in the world of eye care. Can you just briefly explain, like, what is it as an optometrist? What's your training? What do you do? What services do you offer your patients?
Yeah. So as an optometrist, and I think it really depends on where you go because this can vary, but we are the primary eye care providers that you would see for comprehensive and general care. If there's something more specialized or surgical procedures are required, we refer to an ophthalmologist that specializes in that area. So day-to-day would look like routine vision eye exams, prescribing glasses, contact lens fittings, prescribing contact lenses. And we also take care of a lot of like medical infections, corneal infections, ulcers. We also, depending on where you go, which optometrist, we do manage medical optometry. So that can include glaucoma evaluations and management, as well as retinal evaluations and sometimes management, co-management with ophthalmologists for like cataracts, for example, or LASIK. So myself in particular, I do specialize more in dry eye treatments, dry eye therapy, as well as myopia management. But I think it again depends on where you go and who you see. Yeah.
Yeah, so I think it's important that people realize, we're both optometrists and ophthalmologists are eye doctors. So when you say you go to the eye doctor, you're
Right.
going for not just, most people just think, oh, eyeglasses is, what I'm going to go for. But really, it is important to get the full checkup, and
Right.
both ophthalmologists and optometrists can do that.
Yeah.
And so definitely, don't just go for your glasses checkup, get the full eye exam. And that does include dilation, at least an annual dilation for most adults. So, and I love what you said about, co-managing patients, because I think it's really important that our two specialties work together, and, really try to provide the best, most comprehensive care for our patients. And sometimes we toggle patients back and forth, and that's totally fine. So, I have a lot of amazing optometry colleagues that I work with, and I'm sure you have ophthalmology colleagues that you work with. It's really, really a synergy between the two
For
fields.
sure. For sure.
Um,
Like I refer
so
to you all the time for
yes,
my
yeah,
patients as
and
well.
I've sent patients your way as well.
Yeah.
So I wanted to ask you, I was really inspired by you because you're an optometrist, but you're also a business owner. And I know some people coming straight out of school, whether it be medical school and medical training, and they end up doing ophthalmology, or they go to optometry school. They join a group, they join a practice, or they work for a larger organization. But you have decided to become an entrepreneur, and you opened up your own practice, which is not so common. So tell us about that story. Like, why did you decide to open up your own practice? Like, what was the impetus behind that?
Yeah. When I first moved to New York after graduating, it wasn't something that I was really considering. I wanted to just get a paycheck, work, and enjoy like the rest of my friends who didn't have to go to years of like school. But after practicing in all sorts of settings, private practice, group practices, I first started actually in Mount Sinai. Mount Sinai Eye and Ear Hospital Center in the corneal specialty department. Then I moved to Brooklyn Hospital Center for retinal disease. I just continuously experienced patients coming in once it was an emergency, and what we could do at that time was just treat it with medication, and then they would come back again with the same problem. So I was looking for a way to really prevent conditions from developing. And there are so many ways if patients were really just educated or knew about it, or it was available for patients. And so I decided that, really in order to be able to create that experience, I would have to eventually open my own. And, I really think customer service and hospitality is so important. And sometimes that gets forgotten in healthcare. And for me, I really, I appreciate going into a hotel and them remembering my name, and having sort of this special like relationship or connection where I feel like I'm taken care of. And so that's also why I really want to create a different way to practice and experience for patients. And so then in 2020, I opened my practice. During the pandemic, everything didn't get to finish in construction. I was really stressed, really concerned, and but everything worked out in the long run. We were able to like finish the rest of the build at end of 2020 and open closer to 2021. Yeah.
Well, congratulations. And you've
Thank
done
you.
phenomenally well with your practice. I always see your posts on social media, everything you're doing, and how happy your patients are. And I think what you touched on is really important. It's not just going to your doctor and, checking off, okay, I did it this year. Like with eye care, it is really about building a relationship and, knowing, like, for example, when I see my patients, I know their family members, I know what's going on in their lives. Like having that relationship really makes such a big difference, because then patients feel comfortable telling you things that may relate to their vision health. And it is the experience. You want to give your customers, patients, a unique experience where they feel heard and they enjoy the experience rather than not wanting to go to the eye doctor every
Right.
year.
Evaluating everything on the lid, taking images, and then from there helps us determine what they need. And here we do focus on less medicated ways, but we do prescribe depending on the patient, but more generally ways to help patients with providing them longer term results in a shorter time span and little downtime. So one of the main things that we do is IPL. It's also known as intensive pulse light therapy. So we use that for patients who particularly deal with like blepharitis related dry eyes or rosacea and a lot of inflammation. We also use radiofrequency. Radiofrequency helps with meibomian gland dysfunction related causes. But we also use amazing things like stem cell therapy to help with our patients' amniotic membrane treatments on corneal issues, causes of dryness from that. As well as various other forms of like certain eye drops that help with production of oil or tears. So a lot of patients sometimes might have a combination of the treatments to help them along the way, and it really just depends on what they need.
Yeah, absolutely. I think from a patient perspective, a lot of patients get told, oh, you have dry eye, and they just keep putting in drops and it's not really helping. And in those types of situations, it's important to look deeper to find the root cause. And some of the testing that you mentioned, like the meibomian gland imaging, which is meibomography, there are various machines that do that, can help detect, okay, is there a structural problem or are the glands clogged, and then treat that as the root cause rather than just to put the band-aid on the issue, which is drops. And yes, drops do work for a vast majority of patients, but when they're not sufficient, it is important to explore, number one, what's causing it. But then, as you mentioned, like each person may need a unique approach, and sometimes it's a combination of these different things. I always love, the dietary aspect of things and supplementation. So I always talk to my patients about how they're eating. Are they getting enough omegas in their diet? And perhaps if they're not, maybe they do need to take an omega supplement. So I always have that conversation with patients as well. Welcome back to the IQ podcast. Today we're chatting with Dr. Jennifer Tsai. And so, Dr. Tsai, one question I really wanted to ask you, and also for my own education, is when people get a glasses prescription, they take it to the optical store and they're given all these different options, what type of glasses, lenses to get. How do you guide patients? How should they choose whether they should get the add-ons, for example, transitional lenses or specific tints or maybe polarized lenses? Like, what's the type of conversation you typically have with patients?
Yeah, majority of the time, oftentimes, during the consultation or exam room, is really learning about the patient's habits and lifestyle. You can only prescribe what the patient will find most useful in what they're using day to day and what issues they're dealing with. So a patient is oftentimes, let's say, outdoors and is very active, then we might want to prescribe proper lenses with transition if they are someone that doesn't typically like to carry multiple pairs of glasses, for example. And the other thing is like even the frame matters. If someone is very active, we want a frame that is actually very lightweight and comfortable, that doesn't, maybe is like screwless, for example, for the right design for that patient. When it comes to, let's say, like contact lenses, it's also about their lifestyle and day-to-day habits. There's options of like daily contacts versus extended wear. It's, how often does this patient actually wear contact lenses and for how many hours of the day? If someone deals with dryness and they look at screens a lot and they wear contacts quite often, maybe daily lenses would be the best option for them.
Mm-hmm. Yeah, those are great tips. So if someone, I'm just going to ask you this question because we were talking about dry eye earlier. If someone has dry eye, is that an absolute no-no for contact lenses, or do you work with them to try to get a contact lens brand or a technology that's really going to work best for them?
Yeah, I think patients will want to do what they want to do. Of course, if it's actually going to worsen a condition or actually cause like a concern, we wouldn't want to do that. But we try to work with the patient so that they can continue their lifestyle. It's not about changing and limiting what they can do, but it's about working around, again, focusing on the root cause. So there's dryness. How do we actually help the patient treat the dryness, improve the dryness, so that they are able to wear contact lenses a little bit more. So in the beginning, maybe we say you can only wear the contact lenses for special events, but as we work on the dryness and improves, you should be able to wear them more full term.
Hmm. And in some cases, when patients have very severe dry eye, in some of my patients, I recommend that they get scleral lenses. Can you just briefly explain, like, what are scleral lenses and who may they be appropriate for?
Yeah, we also fit scleral lenses quite a bit for patients who deal with dryness, but also with keratoconus. So scleral lenses are maybe, I would say, a much larger lens. It's harder
Mhm.
material. This scleral lens acts as if it's like a new cornea for patients, so it doesn't touch the surface of the cornea itself, and we
It's
fill it
like a
with
little bit vaulted up, right?
a
So it
little
sits
bulb.
kind of above the cornea.
Exactly.
Mhm.
So it because it doesn't touch the cornea, it's very comfortable for patients. It's filled with saline within it, so it allows patients who do deal with dryness from contact lens wear and other causes like corneal scarring and various other things to be comfortable in an option that's not glasses for
Mhm.
patients. But it does involve a process of training how the patients how to wear them because it's a completely different process and educating them how to use it.
Yeah, and to be safe when using the scleral lenses.
Exactly.
This is with any contact lenses. Like, safety is really, really important. I can't tell you how many patients say, "Oh, my lenses are." They say that they're 1 month lenses, so they wear them continuously for
Yeah.
1 month, and that's not a good idea. So
Yeah.
even though it may say extended wear, you should probably not wear them at night. I always counsel my patients just take them out at night.
I always tell them never wear it at night. Yeah.
Yeah, yeah. So
Definitely.
maybe market it a certain way, but that doesn't necessarily mean that it's the best way to use them. Let's talk now a little bit about, we were talking earlier about, being outdoors in the sun. So when it comes to UV protection, now let's shift to talking about glasses. When
Mhm.
it comes to UV protection, what should patients look for to get the proper UV protection in their glasses or
Um,
sunglasses, let's say?
and sunglasses. For proper UV protection, first, it's these days it's hard to tell because not all the eyewear, not all glasses come with a label on the side. Generally speaking, you want to make sure that it's UVA and UVB. Usually on the side, it might say UV 400 as a way to
Mhm.
tell. I'm not sure certain opticals or optometrists and ophthalmologists may have devices in their practice that actually can measure the spectrum of protection on it, like we do, so we can measure it for patients. Sometimes fashion sunglasses or online glasses that you purchase may not have full coverage. And also tell patients like just because the lenses look darker doesn't mean it has more coverage at all. So it's important that you're actually purchasing it from a reputable professional. Typically, if you do buy it from, let's say, optometrists, opticians, and ophthalmologists, we'll use specialized labs from verified companies that make lenses that are certified with the proper correction that it needs.
Mhm.
And the best thing I would suggest is also to have wider coverage. So something that has better
Mhm. Something like
coverage.
wraparound or large. Yeah,
Exactly. Yeah.
absolutely. Yeah,
Yeah.
I mean, I want to just expand a little bit about, you mentioned like really dark lenses that, just because they may be very, very darkly tinted doesn't necessarily mean that they're fully protecting you. So get them checked. And also, they may, if they're not 100% UVA, UVB blocking, the dark tint actually causes your pupils to be wider. So it may actually put you at higher risk for certain eye conditions because your pupils are bigger, more light is coming in, but the lenses aren't really blocking UV as they should. So always get them checked. I always, and patients always say, can you tell me if these are right? And that's the right question to ask your eye doctor. If what you're purchasing, especially if you're getting them online, that they are really protecting you. So I wanted to also chat a little bit about different tints because many people get dark tints like gray or brown or sometimes even black, but some people opt for lighter tints like pink or light gray or amber or even blue. So how do you help your patients choose the tint, if they
Mhm.
want fashion glasses, for example? And what types of tints do you recommend for certain types of eye issues?
Yeah. Very popular one is going to be like, let's start with gray tints. Gray is great for overall brightness, while still maintaining color balance. And so it's great for everyday use, outside activities, driving, for example, gives you this true color perception and bright sunny conditions. I would say brown and amber tints really enhances color, especially when you're outdoors. So people love it when you're doing like outdoor sports activities like golfing or fishing. And it's great for like when light conditions tend to change, helps to reduce like glare. Yellow tints, it can be like a fashion tint, but people also use it sometimes when it comes to like nighttime driving, as well as indoor usage on screens for like computer use. So that's helpful for like low light settings. Blue light, blue tints, I think, I guess it depends on if it's like tinted blue or you're talking about like blue light coating. Sometimes people use it for screen time and eye strain, but also the last one I would say probably important one is like rose or pink tint. It really helps with light sensitivity. So patients who
Mhm.
deal with like screen time usage, cloudy days, I found that it's helpful for patients who deal with like migraines and sometimes neurological issues, that having a rose or pink tint tends to help them as well.
Yeah, and actually, there's a very specific tint called an FL41 tint, which
Mhm.
is one of the rose colored tints that's been clinically shown to help with migraine and light sensitivity or post concussion light sensitivity. So I always try to steer my patients towards that. And there's a version of that, which is it's not pink, but it's more of like an amber color. It's made by this company called Avulux. I don't know if you've heard of it, Dr. Tsai, but they also have a lot of research behind their tint when it comes to helping patients with light sensitivity, because that amber tint blocks out the red and the blue wavelengths, which can trigger light sensitivity, but it lets in green wavelengths. So it's selectively kind of filtering out various different wavelengths of light to help with light sensitivity. I don't know. Have you had any experience with that particular brand or that tint, Avulux?
I've heard of it. We have not, but certainly I think there are ones that are more specialized, that have done a lot of research on ones that actually help patients. So I have heard of it, but I have not used it.
Yeah, and they do have a lot of research behind it. So that's what I
Mhm.
try to steer my patients towards when they're really having issues. And then I also wanted to just expand a little bit about the blue light blocking.
Mhm.
So there is this, I don't know if you're probably aware of this, but they Consumer Reports actually tested like different types of glasses, blue blocking glasses, and they found that most blue blockers, when they're really light, like a almost clear or like a light yellow or very light orange, they're actually not blocking that much blue light. They're usually only blocking about anywhere from 10 to 20% of blue light, versus the deeper tints like deep orange or deep red, they block almost 100% of the blue light. So the tint does matter in that sense. Like if you want full coverage, you want to get the deeper blue blocking glasses, versus if you want lighter coverage, then you can get the lighter ones. What's your experience with that?
Yeah, so I think there's still ongoing studies on what the long-term concern is for, let's say, retinal damage or macular degeneration. We do know, generally speaking, it definitely has an impact on our sleeping patterns and how well we get sleep at night, as well as just feeling like very light sensitive, dealing with glare on screens, and when if you work in an office like fluorescent lighting, it can be very bothersome for the eyes. So I think starting with any type of blue light protection is going to help as is. But if someone is
Mhm.
more sensitive to light sensitivity in general, they want more added coverage. Making sure that like you said, like a deeper coverage in the lens material is going to be helpful. There are also contact lenses actually that have now blue light
Mhm.
blocking capabilities, like the Acuvue Max 1 Days that's built in. So if you have that on and computer glasses with blue light, you're getting added coverage as well.
Yeah, that's a great option for patients as well.
Hmm.
It's automatic, right? You don't have to
Right,
actually
right.
put something on. It's protecting you. So, one other thing I wanted to just have you explain is the difference between polarized lenses and UV blocking lenses, because a lot of people choose polarized, but they may not necessarily be UV blocking as well, right?
Yeah,
Is that correct?
correct. Yeah, so I think the automatic assumption is that I guess there's sunglasses that have UV protection first, is the assumption. And then also that polarized mean the same thing. So polarized lenses, it's just a specialized lens that helps to reduce glare, especially when you're outside, from reflective surfaces. So if you think of reflective surfaces, that would be definitely one is water. So any water activities,
Mhm.
or if you think about snow, anything that is bright off of a surface, roads or glass. So they tend to work by filtering out light that's reflected off of these horizontal surfaces,
Mhm.
and it helps with like improving like reducing glare and just helping with visual comfort. So because remember, light sort of bounces in all sorts of different directions, and it's just cutting out one component. So that's how polarized lenses works in terms of what it does. So it is beneficial,
Mhm.
for example, if you are like driving, if you have winter sports, like we talked about snowboarding, skiing, but also water activities, if you're outside by the water a lot. It is not helpful if you are looking at computer screens, because then it makes it really hard to see the screen. For example, like digital devices.
Mhm. But so just to clarify, so not all polarized lenses are also UV blocking, correct? You
No,
need to make
not
sure
all.
that you're
You
getting
need to make sure.
UV
Yeah.
blocking as well. Yeah,
Yeah.
that's
You need
really,
to make
really
sure
important.
that
You
both.
just ask. Make sure you
Mhm.
ask for that. Um, all right. Well, this has been such an eye-opening conversation. I always learn a lot from my guests, and I've learned from you. So thank you for sharing all your experience, your knowledge. If there's, one last message you would like to leave our listeners with about their eye health, or perhaps, choosing the right glasses or contacts, what would that be, Dr. Tsai?
It's like you said, since we started this, that's very important to have your annual exams once a year. It's not just because you feel like your vision hasn't changed. There are things that we check for outside of that, which includes your ocular health, everything from the front to the back of the eye. Sometimes a lot of systemic conditions that you may not be aware about, like early signs of diabetes, high blood pressure. So that is the first step. And then the second thing is that, it's glasses, think of it like, clothing. You wear jackets in the winter, and you wear lighter clothing in the summer. So glasses are specialized for what you're using it for. And that can range from anything we talk about sunglasses to computer glasses to progressive lenses to distance driving glasses. And very oftentimes people do have more than one for what they're
Mhm.
using it for, to optimize on their vision, because vision is quite important, especially like, for example, if you're driving, you want to make sure that you can see very clearly at night, and having the right lenses for that. So I would say, outside of what people normally know about glasses, that it's it is sometimes a good idea to have a pair for what you're actually using it for. And that
Mhm.
sometimes people have more than one depending on their lifestyle.
Yeah, absolutely. I've had patients come in with 3 or 4 different glasses, and it's,
Right.
they're juggling, but they're much more comfortable than having a single pair. Perhaps they're using progressives, but they're not comfortable with them. Just
Right.
talk to your eye doctor and explore your options. You don't have to be locked into only one thing. So, well, thank you so much for sharing all of your incredible experience and insights, Dr. Sai. If anyone wanted to learn more about your work, what you're doing, reach out to you, maybe even become a patient, how could they find you?
Yeah, so my practice is Line of Sight. We are in Hudson Yards, and our website is lineofsightvision.com. Our Instagram is Line of Sight Vision, and we are also located. Our second location is inside Equinox Hotel in Hudson Yards. So if you're looking for something where you feel like you're getting a little bit of pampering, you can visit us there.
Mhm.
Personally, on my page, if you want to learn more about, I share a lot about eye care tips. You can follow me on social media, on TikTok and Instagram. It's Dr. Jen and Juice, Dr. Jen and Juice, Jen
Mhm.
and Juice. And my personal website is drjennifersai.com.
Wonderful. Thank you. And we'll include all of those links in the show notes. If anyone wants to reach out, you'll be able to find Dr. Sai. Well, again, thank you so much for your time, Dr. Sai. It was really a pleasure.
Thank you for having me.
Absolutely.